Hey, do you feel like you're getting thrown around the healthcare system and are frustrated with the lack of clarity that you're getting from your providers? Do you feel like you're getting suboptimal care and that you deserve better? Do you want help busting some myths and deciphering what's good and bad information out there? If you'd like to be a part of a community that's connected with the best resources in the area and is taking small steps toward their health and fitness goals, then this podcast is for you. My name is Jeff Denning, and welcome to the Seeking Wellness Podcast.
Thanks for tuning in, guys. I'm your host, Dr. Jeff Denning. Thanks for listening to the Seeking Wellness Podcast. It's been a while, but I am back here today with Dr. Ryan Bradbury, MD of Wellberry Health, and he is here to chat with us about direct primary care, which is kind of a new healthcare model and something that I think serves the patients maybe a little better than sort of traditional insurance models can. So, Ryan, welcome to the show.
Thanks for having me. This is great.
Yeah. I'm excited to chat. I think you, as far as I know, are the only direct primary care provider in Southeast Idaho, or
not in Southeast Idaho, but definitely in Idaho Falls.
Idaho Falls.
So
okay.
Up and down the valley, there's a couple other practices that do what I do or very similar. So Dr. Moser in Blackfoot and then Dr. Clark in Pocatello do direct primary care as well.
Love that. I think it can be a really successful model, and we'll kind of talk about what that is and everything. But yeah, let's kind of just jump into your origin story, Ryan. Kind of tell us like how you got into medicine. You mentioned your father's a physician as well, and so give us a little background on Ryan growing up and like what that was like, and if that kind of motivated you to pursue that, seeing your dad work as a doctor.
So it's kind of funny, actually. Yeah. So I grew up, my dad's a family doctor. We moved here in the early 90s to Blackfoot so he could work there at Blackfoot Medical. And during that time, I got to see what home life is like for a doctor. I got to see and hear all the stories about just the system and all the troubles with the system. But I also got to hear all the good things too, right?
Yeah.
And then when I was 8 years old, I was diagnosed with leukemia.
Really?
So I spent a lot of time in my childhood going back and forth between Blackfoot and Salt Lake City, going to primary children's, going through all the chemotherapy. I don't know if I told you that before.
Yeah, I didn't know that.
Between my dad's work and cancer, I spent a lot of time in the healthcare system.
Yeah.
And by the end of it all, I actually kind of had a sour taste and wanted nothing to do with medicine.
Fair.
I knew it was an honorable profession, but I said, no, medicine is not for me. I don't need to be anywhere near a hospital. And plus, I was starting to get some ideas toward the end of my teenage years as I had more experience with fitness. I started seeing that the healthiest people actually were the people that were out doing things, exercising, having adventures, trying to eat right. And just kind of, I don't know why I noticed that. I think maybe it was because my mom's side of the family was more the naturopathic stuff.
Okay.
So I started seeing that there's more to this than just the normal medicines and prescriptions people do. So I kind of latched onto that and thought, I'm just going to go spend a bunch of time outdoors. I thought for sure I was going to be a river guide and a ski instructor during the off season. I thought that was great. And then I served a mission for the Church of Jesus Christ of Latter-day Saints in Maryland. And by the time I came back, I knew that I wanted to have a family, and I thought I should probably live something a little more stable and predictable than a river guide and a ski instructor.
Where you're gone for weeks or I don't know, weeks at a time maybe, but days.
Or maybe there's just no work to be had or whatever. So I turned to look at what else I could do that could be physical and help get people into sport and keep their bodies active. I was actually thinking of going into physical therapy.
Really?
Yeah. So when I started at BYU, Idaho, I thought I was an exercise physiology major. I said, I love this. This will be great. I get to exercise all I want.
Yeah.
I'll do physical therapy. And then I just had some experiences there, I'd say spiritual experiences that told me, no, there's a different direction that I'm supposed to go. And I started opening back up to medicine. During that time, my brother was going to medical school. He's an interventional radiologist in North Dakota. And I saw him and his family and how they were having such a great life. And that had a lot of impact on me too. And I thought, you know what? I'm really good at this school thing. I'm really good, like exceptionally good. So I said, okay, I guess I'll go to medical school. I don't know why. I know that the system has its issues, but I'll go be a doctor. So I did. I went to Ohio State, the Ohio State, I'm supposed to say. And
Yes, as they say.
Yep. And at medical school is where I was starting to look around and see, oh man, the system's busted. Like no one's getting the care they need as fast as they need. They're getting this whole rigmarole that insurance is making them go through. And that's when a lecturer came and spoke to us from a local direct primary care clinic. I didn't know what direct primary care was at the time, but Ryan Kaufman came and he told us about direct primary care, and I was hooked. I was hooked ever since then. So from my first year of med school, when I found out about direct primary care, I knew that's what I was going to do.
Yeah.
And so I've crafted my life about it ever since. So that's kind of the origin story about why direct primary care. I know I could dive more into it.
Yeah.
But that's the gist. That's me, who I am.
Love it. Primary care as a specialty seems to be like the least sexy of the specialties for a lot of physicians, when they're going into match staying and trying to pursue a specific residency. Did that dissuade you at all? Like considering like surgery, I think is a high one, or psychiatry or derm.
Yeah.
Any of the other like hot fields right now, I guess.
That's a great question. And it's no doubt when you're in medical school and everyone's looking around at the specialties, right? And everyone's deciding how they're going to craft their education so they can apply to a residency program. Everyone's talking about money.
Mm-hmm.
Everyone's talking about lifestyle. And there are a few specialties out there that pay a lot more and have a much better lifestyle than your traditional family doctor working in an insurance-based family practice.
Yeah.
So like dermatology and ophthalmology are just known as some great lifestyles that make great money. So I thought about that just long enough to realize, no, that's not what I want to do. My image of a doctor and what I knew I wanted to do in life always has been something more broad spectrum, dealing with people on a personal level in their daily lives instead of just these unique situations where someone has a skin problem or an eye problem.
Yeah.
Right. I wanted something a bit more broad that used all my knowledge, right? And would keep me from getting bored. It would stay interesting.
Totally.
Right.
Yeah.
And family medicine's amazing in that you can dive in any direction you want. You'll never get bored. There's always something new to learn and study.
Yeah, absolutely.
So yeah, I thought about that. But then remember, I found direct primary care. Okay. So direct primary care, and we'll talk about today why that's better for patients,
Yeah.
right? But it's really better for doctors too. It's much better. So in a traditional family practice that's running off of insurance, they have to pay a billing team. They have to have several medical assistants and office staff because they have to see a large number of patients every day to keep their lights on. Insurance doesn't pay enough unless you see many patients a day.
Yeah.
And so you have to have all this extra staff to take care of that many patients that fast. And that just drives the overhead way, way, way up. And as a result, it's very expensive to operate in that realm. And for the doctor, you have to see a lot of patients. This means you're there all the time and you're having to deal with that many more phone calls and that many more messages coming through your medical record system from people.
What's like the average number of visits a traditional primary care provider sees in like an insurance-based model?
So the insurance-based model,
day,
a typical family practice doctor will have to see 18 to 24 patients just to pay their bills, just to keep the lights on in the clinic per day.
Wow.
18 to 24. So
you're looking at 2 to 3 an hour.
Yeah. And they're something like that. And you're not in the room with them that entire time. Actually, most of the time you're spent on your medical record, either recording what you did with the last patient or trying to find the records really quick for the upcoming patient.
Yeah.
Or dealing with phone calls. Like the most frustrating thing is when you're having a busy day where there's like 30 people on the schedule and then you have to take a phone call from an insurance company to try and authorize some imaging or medication that is necessary, but the insurance company insists on hearing you say that out loud. So frustrating.
It's got to be one of the worst things, like just talking to a rep that doesn't have the credentials and the degree and training and knowledge that you have and is best for the patient, and they're just trying to find any maybe reason to deny it or just prevent healthcare dollars from being utilized. I don't know.
Something like
that's
that.
how it seems like.
Something like that. And it's funny. And I get it. Everyone on every side of the aisle is, at the end of the day, they're just trying to make a paycheck and take care of their
Just
family.
do their job. Yeah.
And I think it's the system that's really broken. It's just this whole idea of having insurance pay for your primary care. You don't use your car insurance to pay for new tires and pay for an oil change. So
Yeah.
why do we use healthcare insurance to pay for your annual labs and your regular checkups? Why do we use our insurance to pay for, your regular coughs and colds and simple things that can be taken care of by your family doctor? It doesn't make sense.
Yeah.
That makes insurance cost way, way, way more. Can you imagine how expensive car insurance would be if we used our car insurance to pay for oil
Yeah.
changes and tires?
Yeah.
Be ridiculous. And that's part of why health insurance is so expensive.
Yeah. I'm sure it'd be triple.
Yeah.
Was there a time here that this was not the case, like in the States, I guess, where insurance mostly was just for like those higher level like surgeries or emergency care, and primary care was more of a direct relationship with your family provider?
Yeah. So that's what's funny. When we say direct primary care, it's really just care the way it used to be, right? It used to be before insurance, and I don't know the years and the times that this all came, but you can find it online and people will list, oh yeah, such and such company invented this plan to take care of their employees or something.
Yeah.
Before that happened, I think it was something like 50, 60, 70 years ago. You just paid your doctor for whatever care you needed. And because they were all private practices, that could be in whatever means you wanted. There was a lot of bartering done, So if you were in small town Idaho way back then, you may trade a chicken or trade a cow or some milk or something because they came and took care of your kid who had the measles.
Yeah.
Or whatever was going on.
Interesting.
So we're just kind of going back to that. And it's funny, I actually do a bit of bartering still. Just
How so?
saying, just trade like, membership for membership, or
Gotcha.
I haven't done this yet, but I know a lot of direct primary care doctors have said, membership for advertising or membership for repairing stuff around the clinic, things like that. Because anyway, it just works out smooth for people.
That makes sense. So just you've kind of hinted at it, I guess, but direct primary care, what's your definition of that, and kind of how does that frame your philosophy of how you interact with patients and work to treat them?
Yeah. So direct primary care. Direct just means we're taking insurance out of the payment relationship. It's just
No
patient,
middleman.
doctor, no middleman there. Our billing is as simple as a payment method that's on file, and it just comes out of your bank account. That's simple. And if there's anything extra that comes up, like labs, meds, or imaging, which we do at cost, I just say, example, Mrs. Smith, is it okay if I charge your payment method for this $5 medication? Check. Done. That's the billing. There's no CPT codes. There's no ICD-10 coding. It's all just this right here, and the payment's done. And you take away all that overhead and all of that headache.
Okay, that's nice. And so kind of walk me through like what kind of patients are you working with, or what's, I guess, who's walking into your clinic, right?
Yeah. I get a good mix of people coming in from all walks of life, people who have insurance and people who don't have insurance. And what they all have in common is that they're just looking for better health care.
Okay.
They want more time with the doctor, and they want easier access. So the biggest values that I add is time. In your typical practice where we said they're having to see 18 to 24 just to keep the lights on, in reality, they're seeing, hopefully they're seeing more than that because they actually want to take some money home at the end of the day. But a lot of them are seeing 30 or even up to 40 patients a day. And that means between the billing and the charting and the records looking up, all of that, they're only getting on average nationally, I think last I checked, it's 7 to 10 minutes in the room face-to-face with a patient like
Sounds
this.
about right. Yeah.
And so there's only time to barely address one issue usually, and they don't get to hear the whole story. So the time, I spend 30 to 60 minutes face-to-face with a patient when they come in. So I get to hear the full story. And there's a saying in medicine, if you listen long enough, the patient will tell you what the problem is. And it's funny, I actually just was joking with a doctor friend over lunch. I was joking that he's going to be seeing a lot of people every day. So his model is going to be, if you talk enough, the patient will hear what their problem is. I would say he's just getting it backward. The idea is if we listen long enough, the patient will tell us what's wrong. And so I give people that time. And And then the access, they get an on-call phone number that comes straight to my phone, and they can call or text at any time if they have a question. So if it's after office hours, and they're wondering if they should go to an urgent care or an ER, I can talk them through that situation, and we most of the time keep them out of an urgent care.
Yeah.
If it is a true emergency, obviously I'll send them to the ER, but even things like that, we can take care of a lot of stuff in the clinic that doesn't necessarily need the ER.
You can kind of triage that.
Yeah.
Do people abuse that then? Do you feel like people are
I
calling at
I haven't had anyone abusing it yet. I have had what I'd say a few people that utilize the service a bit more for their first few months, but nothing that was ever annoying or bothersome. And it's really just, we're getting people, I like to say, tucked in. We're getting you tucked into your health, calming down all the issues that have been issues because you've come from the traditional healthcare system. And now we're getting those calmed down and tucked in, and we're setting into more of a long-term view now, where we're working more on habits and we're working on the daily things you're going to do to prolong your health. Yeah. And my colleagues across the nation, I'm part of the Direct Primary Care Alliance, which is this national organization of doctors that is trying to spread direct primary care.
Yeah.
And I was on their board last year. It's a great organization. And all these colleagues are saying the same thing. They said they had a few, they were really worried about high utilizers. And it turns out they just needed to be listened to. And they were able to tell the doctor what their problem was, and they were able to get it solved.
Yeah. I love that. I kind of have the luxury of working with my patients in a similar capacity. My appointments are usually about an hour. And I give my patients full access to me as well. If something comes up when you're trying the exercise I tried to give you at home and it's not going like it did in the clinic, or it is going great, maybe that's nice feedback to hear as well, right, too. You can always text me. Most of the time they don't, though. And so I haven't found an issue with people kind of being overzealous about like connecting with their providers too. So that's great. I'd love to touch on the habits just kind of a little bit more, because I know that's a big foundation in your practice. You did mention that both people with and without insurance kind of use the direct primary care model. How do you see the conjunction in kind of blending it with traditional insurance,
right,
versus just using it as mainly your primary source, I guess, of healthcare?
So nationally, it's estimated that your family doctor can take care of 80 to 90% of all problems that could ever happen to you. And it's the other 10 to 20% of emergencies that you need to have some way to pay for those things. So you need to have some mechanism, some product to cover the catastrophic stuff, to cover ER visits and surgeries and cancers and whatever other terrible things that happen to people. But for the rest of that, it's oil changes and new tires, like on your car, right?
Maintenance stuff, yeah.
And so people do need a mechanism. And what I see people do is, and again, this isn't financial advice, but I've seen people buy the highest deductible, lowest monthly premium insurance plan they can find, and then just never use it. And the money that they're saving, they pay for a membership with a direct primary care clinic, and then they save the rest of it to pay for that deductible if it's ever needed. And then, because on average people only dip into their deductible, I can't remember what the last stat it was, it's like every 3 or 5 years. That's how often people actually end up using their deductible.
Yeah.
That means if you're only using your deductible every 5 years, that means for 4 years, you could have just saved all that money, right? Instead of paying it into your premiums.
Yeah.
So
makes sense to me.
You get to save money that way. Oh, and the other thing I see people do is they will get a health share. So health shares are different from health insurance. As a user, it looks and feels similar. They have different terms they use. They don't use deductible. They use maximum shareable amount. And instead of using monthly premium, they have a term, I think it's, monthly contribution or something like that. But these started from like Christian organizations where congregations wanted to help someone in their congregation that was sick. So they all pulled their money together and say, when that person gets sick, we're going to help them out. Well, that model grew and grew until there's several national organizations now that work very similarly. Really? With that same principle of everyone's giving a contribution every month to help cover everyone's health issues.
Yeah.
And because it's not insurance, they don't have the same regulations that insurance have. Because they don't have the same regulations, now they can exclude people that have certain conditions which lowers everyone's monthly contribution they have to make.
Really? Okay.
Essentially, it ends up feeling like very cheap insurance for people that use it.
Yeah. Okay. And it probably is relative to monthly premiums that you would pay with the
Yeah.
Blue Cross or whatever.
Yeah. So, for instance, if someone were paying $600 for their monthly Blue Cross, and I don't know exact numbers, but these are in the range I've seen, they might be paying $300 or $400 for their health share.
Okay.
And then if they pair their $300 health share with my $100 direct primary care membership, well, that was $200 in savings, and there's no copays.
Yeah.
When they come see me, right?
That is nice. Do you see kind of people across the age span as well? Are you seeing pediatric patients or mostly adults or what?
Yeah. So I'm family
Caseload.
medicine trained. So family medicine is a specialty in medicine. I took board certification exams in family medicine from the American Board of Family Medicine, right? And that means everyone in the family, little babies on up through grandma and grandpa. So I can see newborns in the hospital, both hospitals here in Idaho Falls.
Really?
And then I can also take care of grandma and grandpa. There are families that love what I do because it is an affordable way to take care of the whole family. And the doctor knows the whole family dynamic and what everyone's going through and how people are interacting with each other, parents to parents and children and whatnot. So for instance, at my clinic, it's $247 a month for a family. That's the equivalent to the cost of 2 adults and 1 kid. That means for every kid after that first one, they're essentially getting a free membership. So I have families with 6 and 7 kids that are coming to see me.
Yeah.
And
Wow.
it's $247 a month.
Yeah.
The same as if they only had 1 kid coming to see me.
Okay. Yeah. That seems like a pretty
I wanted to
killer
favor,
deal.
I wanted to favor large families because I have a large family. I have 6 kiddos and we're expecting more. And
holy smokes.
not that we're pregnant, but we would like to have more.
Yeah.
And
Amazing.
we just want to take care of the larger families because I feel like they're the ones that are keeping society moving.
I respect that. Side question, I guess, would you encourage your patients to kind of go the route that you and your dad, their grandpa have taken with the medical school and everything?
Would I encourage people to go to medical school?
Yeah, or your kids specifically?
It's funny. I tell people, I joke with my wife, so we homeschool. And I say, I will feel like a successful parent if my children don't go to college. Which is funny. I feel like all of us that came up through the 80s and 90s, we were all shown this chart that said, this education equals this salary.
Yeah.
You get a little bit more education, your salary goes up more. More education, your salary goes up more. And that's just a whole fat lie.
Yeah.
Now we know that education doesn't amount to jack. It's really, what can you do? What can you contribute to society to do to help people? And for the most part, that doesn't need a college education. With YouTube and all these online courses you can take now, you can get this education for free or very little money.
Yeah.
And you can be out there helping people with real skills that they'll pay you for.
Interesting.
And so would I encourage my kids to go to college? And my answer is, I'd say only if you really feel like you're going to do something that requires it legally.
Yeah.
So if you're going to be a doctor or a lawyer or a physical
Have to do
therapist,
that,
something that
obviously.
requires it legally, then you can go to college. But I don't know. But
Yeah,
I feel like if my kids are going to figure it out, and I'll help guide them. I think medicine's still a wonderful career. You don't need to shy away from it. I think it's heading in a better direction now than it was, say, 10 years ago when I started my medical training. I think, especially with direct primary care becoming more prominent, I think we're going to see just better healthcare coming in the future.
Yeah.
And sorry, I'm going to keep talking about this because I'm really, I really feel like
I love it. Yeah.
Great way. So like the Make America Healthy Again movement. But there's just great things happening. That's all last thing I was going to say.
Yeah. You're pretty optimistic about the future.
I'm optimistic about it.
Yeah. That's nice to hear. I think we get a lot of pessimism and just doom and gloom. So it's nice to hear that someone is optimistic about the future.
Yeah.
So backtracking a little bit, I guess, what's kind of the average patient that walks into your clinic? I know we just mentioned that you see people across the lifespan, across the spectrum. When I think the average person hears primary care on the street, they're probably thinking like, kid's got a runny nose or they've got a cough that they want to get checked out maybe. But what kinds of conditions and things are you seeing in clinic?
So maybe the best way to demonstrate that will be just kind of walk through what I see as being the ideal relationship, right? With a patient and their
Sure.
physician. So first off, we have research where we know that if a patient has a long-term relationship with one doctor that knows them well and they know the doctor well, we know that that person is less likely to be hospitalized, and we know that they are going to live longer and healthier. So that's the first thing, as I say, people need, that's what primary care is. It's supposed to be that long-term person that's known you and you've known them so that you can catch stuff early when it comes up, so that you
Totally.
can call them or text them if there's an issue and get it early on before it becomes something that needs an urgent care or a hospital. So it's a lot of that preventative relationship that we're establishing. So first, any patient that joins my clinic, we get them in for their first initial visit. I call your first visit.
Okay.
And it's a 1 hour visit where we just go through an in-depth history, asking all the things going on in their life that could be affecting their health. And then I also learn where they've been in the healthcare system. I have them identify every, hospital, imaging facility, other clinics, specialists they've ever been to, surgeries, and then we can get records from all those things. And we start to put together a full picture of who this person is and what is happening with their health and what's happened to it so far. So that's the start of our relationship. And then after that first visit, if there's action items, we make a plan and we go for it. For instance, if we find out, oh, you've got high blood pressure and it looks like you've been to all these other specialists for high blood pressure, let's make sure we come back in 2 weeks after we've done let me back up. I do lifestyle medicine, right? So I don't necessarily start medicine, but if they're on a medicine, I'm just going down this blood pressure example, but we don't have to go down that one.
Yeah, let's circle back to it though.
Yeah. During that first visit, during every visit, I like to give people a lifestyle medicine prescription. So I actually have prescription pads in my clinic that say lifestyle medicine prescription on them, and I sign it as their doctors. And I will give them that as homework. And I'll follow up in a week or two or whatever timeline we decide on based on what their prescription was. And I'm not, dictator saying you have to do this. This is your prescription. Most of the time it was a discussion we had, and the patient came up with the prescription themselves, and I'm just here as an accountability person, your physician said you should do that. So if it were blood pressure, say we'd follow up in 2 weeks and I'd say, okay, let's see how you're eating now. How's that looking? Or let's see how you're exercising now. Or say I thought maybe they have sleep apnea, I'd say, have you scheduled that sleep study yet? Or whatever it is that we discussed. That was another thing I loved about this model is I have time to personally follow up with my patients. I have a little spot in my medical record system where I just tag it and it goes on my to-do list when it's time for me to follow up with someone about the lifestyle prescription we did. So I call or text people and say, hey, how are your efforts at eating more of this? How are your efforts at sleeping this long? Whatever it is.
Pretty unheard of, I think, in the healthcare world to get a follow-up phone call or text from from the doctor, him or herself.
Right.
Maybe one of the nurses, or more likely a front desk, or someone.
If you get a call at all.
Yeah, if you get a call at all.
Most of the time you probably don't get a call at all.
So a lot of lifestyle changes. I think those can be hard conversations to have and really challenging to make a positive impact. Sounds like you're doing well, but just I know nutrition can be a big hang up for a lot of people. What's your kind of approach to having if this person's severely obese or something in your clinic and they need to make some positive changes in their diet and their food intake, I don't know, how do you approach that kind of conversation sensitively?
Yeah. First of all, I look at all the health factors as a whole and see, yes, we can identify and say that their BMI is very high. They have a higher body fat percentage. But is that really is the food intake really the issue, or is it that you're stressed out all the time? Is it that you aren't sleeping at all because you've been on night shift and then you've got kids to take care of during the day, or whatever issue it is? So I'm working on this board certification in lifestyle medicine right now. I'm in what's called I don't know, they call it probationary period or whatever. You have to wait 2 years to be in private practice. You have to be in your own practice for 2 years doing this before they'll grant you the certification.
Okay.
So I've done all the training in that. It's just waiting for the certification period.
Gotcha.
So the 6 things that the American College of Lifestyle Medicine emphasizes are the 6 pillars of health. So it's sleep, exercise, nutrition, social connection, stress, and avoiding risky substances.
Okay.
So that first visit we get together, we're talking about those 6 things, and
Yeah, I
we're
love
seeing
that.
which of those is the hot spot that might be causing whatever's going on in your life. And so, for instance, if it's being overweight, yes, we can say it's the food, but also this person's just struggling with terrible depression because they have no friends. They got laid off last week or whatever it is.
Yeah. So no wonder they're eating like crap.
Right. So let's talk about your mental health, and let's see if we can get you involved in some healthy social connections.
Yeah. I love that.
So I don't like to just belabor nutrition. Most of the time when it comes down to it, if I say, what do you want to change about how you eat? Everyone's able to tell me something that they shouldn't be eating that they are, or everyone's able to tell me they don't eat
People know.
vegetables.
Yeah.
People know. What they need is support for why they're eating that way. And education on what is right to eat and what's wrong to eat is easy enough to come by. Anyone can look that up. But for someone to non-judgmentally walk you through your life and help uncover maybe why you're eating that way, that's not something you can just Google. That takes a real relationship with someone.
Yeah. That's fantastic. I think kind of a similar sort of philosophy from a lot of the mentors that I have, and just the framework that I operate in, like just kind of the idea that people don't need more like facts and education necessarily. They need someone to listen to them. They need inspiration, maybe even, right? Like it's a big reason why I try and promote the lead from the front idea. And I am doing the same things that I'm asking my patients to do, like in the gym, doing CrossFit, working out, a few times a week, and getting my heart rate up and making those positive health changes.
Yeah.
And they, I think, are more receptive to see like, oh, Jeff like actually practices what he preaches, and not just, he's not just like telling me this. He's not just giving me a pamphlet to like go read, like, go exercise 30 minutes a day, but he's like in the trenches with me, sweating and getting that sweat equity. So
they get a personal relationship too, right? Like,
yeah,
I know a lot of your clients, I imagine, come from the gym and working out
Totally.
next to you. I know when I think about it, it's like, yeah, something comes up, I want to go see Jeff because I see him a couple times of the week anyway. Right? Yeah, I think that's awesome, leading from the front. And I try to do the same thing. Like I said, I go to the same CrossFit gym as you. And
yeah, so we're not biased at all.
yeah,
But
I know, not biased. I love CrossFit, by the way. It's I love the functional movements of it all. It's great, and the social connection that's there. It's you don't get that at a regular gym unless you are a naturally social butterfly kind of person. At the CrossFit gym, it's just built into the way we do CrossFit.
Totally. There was a cool study I saw a while back that was looking at participants just going through kind of an exercise protocol. One of the protocols, I think, was either with like just one, like a personal trainer, or it might have been by themselves, just kind of going through whatever the list of exercises was. And the other group was like in the research, they call it high intensity functional training. So CrossFit, basically, with other people doing, kind of a structured workout with a warm up, the workout, cool down, all that stuff. And so they made the groups similar in like how they were dosing the exercise and what movements they were doing. But the cool question, I think they even got roughly similar outcomes, but I think the big standout point to me was the question they asked the participants at the end was, after 12 weeks or so, do you want to, or do you intend to continue doing this kind of exercise modality? And it was, a quarter to like maybe a third of the participants in the solo group or with the personal trainer said they would continue on, which is not that successful, but 100% of the participants in the group, in the group class, said, yes, I want to continue exercising. So just kind of speaks to that like need for like intimate social connectedness,
a relationship.
Yeah. So I think that's cool. I like the kind of the 6 pillars. Tell me them again. From the college.
So exercise, nutrition, sleep, stress management, social connection, and avoiding risky substances.
When you have talked with patients that have, and you've both kind of agreed that maybe they need to initiate an exercise routine, where does your mind go first? Or I mean, I'm sure it's kind of patient to patient and it depends sort of answer, but
it's kind of funny. As I was on my way over here for this podcast, I was thinking like, what is one message I could get across to people? If they were to take one takeaway about their health from this, it would be, you would be shocked at how little you have to do to get a positive impact. And it's just right there. You just have to do something, do anything, and you'll get some positive results. So people will say, I want to exercise more. I say, that's awesome. I don't want you to feel like you have to go do a 60-minute CrossFit workout 4 times a week to get the benefits. You don't have to. The studies that were done where they came up with the numbers nationally for how much exercise we should get were done with people walking. So when you hear you're supposed to get 30 minutes of exercise 5 days a week for 150 minutes total, that was people walking before you started. Like just walking 30 minutes a day, 5 days a week is all the benefit you need to decrease risk of stroke, to decrease risk of diabetes and obesity, to dementia, all these things. All the benefits came from something as simple as walking. And I often challenge patients because people come to me, they're often sick, right? People come in sick and a lot of people aren't ready to go jump into a gym routine.
Totally.
But most people can go walk. And even the healthiest people you see are like, hey, that person's pretty healthy. If they haven't been doing an exercise regularly, they might be shocked at how their body takes it when they start walking intentionally 30 minutes a day. I remember I started this in medical school because it was just hard to find time. And I said, you know what, I'm going to do this 30 minutes a day every morning thing.
Just walking. Or
the first few weeks were brutal, right? So here I was 20-something-year-old me. I thought I'm in good shape. Like I can go run a 5K, but walk 30 minutes every morning for 5, 6, 7 days straight. After that 3rd or 4th day, I'm like, man, my hips and legs and knees, like there's changes happening in your body when you start doing something like that regularly.
Yeah.
And I just kept it up and I was shocked at the changes I saw health-wise just from walking.
Really?
Mm-hmm.
Do you attribute that to the physical nature of the movement or more of like the getting, probably a combination of both, but like just getting to spend some time with yourself and being out in nature and all that?
Right. You just mentioned some other benefits, right? The mindfulness stuff that helps with stress. I'd say it's just doing something consistently. Being consistent, that's the biggest key. Whatever you do is consistency.
It's hard. Yeah. I think the consistency is the key step. The intensity like is there with CrossFit, but if you can't be consistent with it, maybe it doesn't matter. Like if you're going once a month, but so finding something that you can be consistent with, whether that's just walking 30 minutes a day can make a positive impact. Saw another study while back that I think was looking at more of the geriatric population, but they were trying to get them to do sort of what your task is, get them to do any movement. They had identified that they have 0 or like less than 10 minutes of intentional movement per week. And so they set out to do like a very simple task. We're going to do 1 minute total of exercise per week. And so they did a 10-minute EMOM, I think. So that's a CrossFit term for people that don't know, but it stands for every minute on the minute. It's kind of a circuit style workout that you'll set a timer every 60 seconds. It'll go off and you'll repeat that same movement or the same couple of movements, or maybe move on to a different movement, but you're on a 1 minute timer essentially. And so basically they're having the participants, every minute that goes off, you're going to do sit to stand. So stand up from your chair, sit down for 6 seconds is all. Just 6 seconds of work. Stand up, sit down as many times as you can. If that's 1, if that's 5, great. Rest for the rest of the minute. When that second minute comes up, you're doing it again. So 10 minutes total, but basically 60 seconds of work.
Yeah.
At the end of the study, they found some significant changes in their health and bone density and all this crazy stuff. So even as little as one minute of exercise a week is really can have some positive impacts.
Just do something, do anything.
All movement is beneficial, I think. So
where they, again, just referring back to the studies where they came up with the 150 minutes, you see this kind of this curve. I'll do it with the camera so you can see this curve that goes like this. Actually, no, I take it back. It goes like this other way. So basically they said, Yeah, it kind of plateaus, but like they just picked 150 as like the sweet spot where it seemed like you got most of the benefits. But if you want to get like 98% of the benefits, that's where they get their top number, which is 300 minutes. So by the time you've done 300 minutes a week, you've achieved almost all the health benefits you're going to get. So people don't feel like you have to go spend 2 hours in the gym every day, because I've seen people go that other way and they end up injured or burnt out or something.
Yeah.
But
That's
not most people's problem.
But it can be intimidating and maybe a misconception that they have to be working out for whatever 15 hours a week to get any benefit. But yeah,
but an hour a day, 5 days a week, that gets you pretty much
plenty.
all the benefits.
Yeah, love that. Is the conversation about stress and kind of mindfulness, do you have like what kind of sample routines that you're giving people, or how do you approach that particular lens of health? Because I know that can be a little like woo woo. Like I've recently started journaling, and that's really helped me a lot. But I know mindfulness and mental health can be super variable, like person to person.
Yeah. Again, it's whatever's going to work for people, whatever people are going to stick with the most.
Something sustainable. Yeah.
So some people love drawing, some people love writing, some people love doing some slow yoga at the end of the day. That's all great things. And I just find what's going to work for them. And I love if you're going to do something like walk, that can be your mindfulness. You're hitting two birds with one stone. Yeah. And if you want to even bring in, like walk with your spouse, now you're hitting 3 birds with one stone, right? Now you brought the social connection. So that's all good ideas. One of the biggest thing, around here, there's a lot of religious folk, right? So I tell a lot of people to pray, and a lot of people do that naturally, or they'll study scriptures.
Yeah.
But even outside of that, just getting some time alone to breathe and just think through stuff without your phone for a few minutes is huge. It's great. Again, these things are all so tied together. They're all so tied.
Yeah.
So sleep is one of the pillars, right? If you want to sleep well, you should have a regular routine in the evening, maybe starting 60 minutes, maybe 90 minutes before the time you want to go to bed. And that routine, there should not be a screen as any part of that. Your phone or TV or whatever device you're using should be put away 90 minutes before bed, so that you can have this time for mindfulness and let your brain calm down and deal with the things that happened that day and mentally prepare a little bit for tomorrow.
Yeah.
And so I think that's just a great mindfulness activity right there, is putting the phone away 60 to 90 minutes before you go to bed.
Yeah. Are there any other sleep kind of hygiene tidbits you throw at patients, or is that your favorite one?
That's one of them. The other one is just having a routine. A routine is huge.
Okay.
And that's just hard in today's world, right? Most of us, we try and pack in all of our life in the evening, right? And so every evening, after work, you try and fit life in. And so everyone's evening looks different. And then if you throw in kids like I've got, it just makes it even harder.
Totally.
But having a regular routine where you can just tell your brain, all right, we're playing the sleep tape now. By the time the tape's over, we're going to fall asleep. And so I tell people to literally write out on a piece of paper what they plan on doing starting at 60 minutes before they go to bed. And you want to do that consistently every night. And you train your brain to say, oh, I go to sleep at the end of this.
Yeah.
And your brain will start doing that after a while.
It's a habit. It's starting to reinforce some of those neural pathways and teach your body that this is what we do.
Yeah. And so some common things are, maybe you shower and maybe you journal, and the last thing you do before, and then you go read for a bit. And then the last thing you do before you go to bed is you brush your teeth, use toilet, lay down. And your brain just cues, oh, every time I brush my teeth, use the restroom and lay down, I fall asleep. And so if you find yourself laying in bed for more than 20 minutes after that, we'll go repeat those last few steps of your routine until your brain gets the message.
Yeah, just repetition. Do you have a routine, Ryan? A bedtime routine?
I do. And it's pretty similar to what I just said.
Yeah.
It's pretty similar.
Awesome.
But yeah. My wife and I made the acronym years ago, TJPP, Teeth, Journal, Plan, Pray.
Okay.
And so we do those 4 things, and then we also tag on read to the kids. And that's kind of how we end the evening.
Yeah, that sounds nice. What time's bedtime for you? Just curious.
It's always changing. We played with so many different wake up time. Basically, we based it off of our wake up time. And over the years, we've we've never had a wake up time later than 6:30. And so we actually just currently switched back to our 4:30, which is the one we did for like all through med school, was the 4:30.
Wow.
Because that's, in today's world, if you're not, I feel like if you start your day much later than that, like especially with kids, then other people start taking your time. But at 4:30, man, I get so much done waking up that early in the morning and just getting after it. The downside is it does hamper your evening, which means, that if I want 8 hours of sleep, I have to have lights out at 8:30, which it's kind of a downer. But we switched back to it about a week ago because the benefits just outweigh the cons. So we're going for it again now.
No, that's cool.
People can give it up whatever time they want. I just say at least plan in 8 hours of sleep for yourself. Most people need 7 to 9. I'm one of those people that needs closer to 9, and my wife needs closer to 7, which causes some contention.
Yeah. No, I think, do you find that most people are hitting those numbers, or are they short on kind of the sleep?
I've been wondering that. Every time I ask patients and they tell me how much they're sleeping, I always wonder, like, is that accurate? And honestly, I don't know.
Do they have a good gauge?
Don't know.
Yeah.
Right. I have no idea what to believe when people say how much they sleep anymore.
Yeah. Just kind of have to take their word for it.
Yeah.
Tell me about some success stories you've had, I guess.
Yeah.
Ryan, either as your time, because I know you recently just finished residency and
last year,
and I'm sure you've had some good success with that, but either that or during your practice, which you established.
So I think
summer.
One of my favorite stories that comes back, I think it was one of my earliest success stories with lifestyle medicine, was someone came in, new diagnosis, diabetes. I diagnosed them right there. We did the blood test and saw, oh, your hemoglobin A1C is like 12.5. That's why you feel terrible all the time. And that's why your vision's blurry all the time. And we started a few medications, and I do start medications, right? I'm an MD. That's what I do. It's not all I do, but that's what my license is especially qualified to do, right? A lot of people can do health coaching and counseling, but my license allows me to write prescriptions and orders. So the medication is there as a Band-Aid to prevent any scary stuff from happening while we take care of your lifestyle. And like any Band-Aid, it's supposed to come off eventually. And I think a lot of people, a lot of patients, and a lot of doctors forget that the Band-Aid is supposed to come off eventually. So we say, all right. And with this person, we started 2 or 3 medications because their blood sugars had been so high and out of control, just to keep them from having any worse health problems in the meantime, right? I didn't want them to have a heart attack or get diabetic ketoacidosis or have some permanent neuropathy or vision loss because of their diabetes or kidney failure. So we do the medications, and then I had a really long conversation. That I remember that day in clinic, I had a particularly large amount of time, and I was able to talk with them about it. And it stuck with them. I was shocked. So like we left that visit saying they were going to walk, and they had identified themselves some things they knew they needed to cut out of their diet. It was like tortillas and bread, and soda. And they came back a couple weeks later and told me that they had been walking and that they had quit eating bread. And I was like, really? And already it'd been just 2 weeks, and diabetes wasn't their only issue. Blood pressure was there, weight and all that. And already after 2 weeks, they had lost like 5 pounds, and their blood pressure had already dropped like 10 points because they had started walking, and they cut out sugar, they cut out bread, they cut out soda. And then within 6 months, we had them down to just one medication, metformin, at half of its max dose.
Wow. And
they were off of the other 2 medicines that we had started. Their blood pressure was normal. They had a hemoglobin A1C that was almost completely normal. It was odd. And they lost like 30 pounds. It was just, and all they did was keep walking. They just kept walking, and they kept staying away from those other things. And they started eating more vegetables. That was another thing. I started doing this where I take my laptop into visits with patients. And so I always bring up a picture of a salad on my laptop, and I say, when was the last time you ate something that looked like this? And it's just a big bowl of salad. And, a lot of people will say, oh, like a month ago, I'm like, oh man, no wonder you're feeling terrible. And so this person, I did that with him, and he's like, I eat a lot of salad now. My wife laughs now every time she sees me eat a salad, but that's what I do.
Get some leafy greens in.
Yeah.
That's awesome. Yeah. That seems like a really, a powerful, story and kind of testament to how you treat. I guess the overarching philosophy then is we'll try some lifestyle changes first, but the medication's there if needed, or
It depends on the circumstance, what
Yeah.
everyone's facing. So if we're looking at starting a medication, I'm slower, I'd say, than most doctors trained in traditional Western medicine. I'm slower to start a medicine than most of them are.
Yeah.
So for instance, I'll give people a little leeway if their blood pressure is high, but not too out of control or scary. If they're not having any issues, I'll give them some time while we work on lifestyle stuff.
Gotcha.
Or if their cholesterol's a little high, before I go and start like a statin, we'll work on lifestyle a little bit longer. Unless of course the patient wants to start something earlier or it's medically indicated. But I'd say I'm slower to start medicines and I'm quicker to take them off than a lot of doctors are.
Yeah, I love that. Ryan, just kind of wrapping up here. You've got a workshop coming up this weekend at our gym at CrossFit Am Rock. Kind of talking about, I imagine, some similar things that we've talked about today, but can you tell us a little bit about what the workshop entails? I know there's a workout component to it and kind of a conversation afterwards.
Mm-hmm. So the idea for the seminar, so first off, it's this Saturday, April 12th, 10 a.m. at CrossFit Am Rock off Lindsay Boulevard in Idaho Falls. And this idea kind of came from this national movement called Walk with the Doc, where people would get together regularly and a doctor will just walk around the greenbelt or something together, and we'll have normal conversations. And how you were saying, as a physical therapist, you're working out in the gym with your people. And I'd say, the idea is you would walk with your doctor and you'd both be doing something healthy. So
that's great.
The owners of CrossFit Am Rock and myself, we thought, what if we did a workout with the doc, right? So this is our first one. We're feeling it out, seeing how it goes, and then maybe we'll do more. We'll see how it goes. But you show up, you register online for it. The Rocky and Andrea, the owners, they'll have a few minutes where they kind of introduce you to the gym and what they're about there. And then I'll take, the remainder, maybe 15 minutes or so, and talk about much of what we talked about here today, just introducing it to people because they need to know that there is a doctor in town that is interested in habits like they are, and they can actually go get the care from someone that has similar mindset to them. And then we'll work out together. There'll be a scaled workout, which means it's not our typical CrossFit workout where you're afraid of, how am I going to be able to do all that? No, this is a workout that anyone of any skill level and any fitness level can participate in. We can adjust intensity and reps and duration based on whatever their needs are. And that's one of the things I love about CrossFit is every workout is supervised by a coach that's helping you adapt the workouts to you, whatever your load needs to be, or whatever the exercise, like if you need to change the exercise to meet your physical needs, that's okay too. I've loved it. I hurt my wrist a couple weeks ago and they've been helping me adapt all my workouts so that my wrist is okay.
Yeah. Shout out to the coaches at CrossFit Am Rock. They really do a great job.
Yeah.
Did you write the workout or who's?
No, this was, I think Andrea's in charge of the workout.
Okay.
Yeah.
Cool.
I'm just providing the seminar lecture.
Yeah.
So.
Well, that'd be fun. So workout, kind of a lecture on lifestyle medicine. Anything else we need to know about that? Where can people get in touch with you or talk to you about that?
Mm-hmm. So if you want to learn more about my clinic, we have our website, wellberryhealth.com, and there's an Instagram account and there's a YouTube account. They don't have a lot on them, but there's stuff there. And if you aren't in Idaho Falls area and you're looking for a direct primary care doctor, there are ones, like I said, up and down the road from us. But yeah, that's the biggest stuff. If you want to learn more about lifestyle medicine itself, go check out the American College of Lifestyle Medicine's website, aclm.com or .org. But it's amazing if you want to learn about lifestyle medicine.
Perfect. Before we wrap up, Ryan, sometimes I like to just ask my guests just a personal question, kind of related or maybe unrelated to anything we've talked about today. But just so the listeners get to know Dr. Ryan Bradbury on a more personal level, which sounds like they do as patients for the most part. But what's like an inadequacy you're working on or like a shortcoming you have in your life that you feel like you could also maybe make a positive change in tomorrow or whatever?
Right. Because I'm not perfect, right? Those 6 pillars, I'm not the best one at it.
Yeah, same here.
I mentioned it a little earlier. I'm trying to work on the sleep thing. Okay.
The sleep. Okay.
So I've got 6 kids. We homeschool. The oldest kid is 10 years old right now, and starting up my own business. trying to work on sleep. I feel like wholly inadequate. It's funny. I was actually talking with a health coach earlier today.
Really?
With Andrea actually. So Andrea is we're doing an employee health program together.
Very cool.
And so she helped me set my own sleep goal.
There-
So
yeah.
so I'm working on. That's why I remember I said a week ago I was revamping my sleep routine. And
Mhm.
so here I am. That's what I'm working on right now. It's the one. I feel like if you can get sleep right, then you can make better decisions throughout the entire day in all the other areas.
Totally.
So I often, sleep.
Yeah, I think if you are sleep deprived, it becomes much easier to skip the gym, go to McDonald's, just a little more on edge, maybe not as mindful as you would want to be. So I think that's a great. I'm glad you're working on that and kind of leading from the front and by example. So
Thanks.
Okay. Well, thanks, Ryan. This has been the first podcast back for me for a while, so I appreciate you being willing to come on and share your knowledge and expertise with everything, kind of getting me out of my slump and back into the groove of things, because I think it's important to really get the message out to communities and so that the people are more aware of the good resources that they have here in Southeast Idaho.
Absolutely. So. Let's point some more people towards your podcast so we can get some more speakers on here.
Yeah, let's use it as a resource and kind of highlight some of the great work that we do have here. So thanks for listening, guys, and definitely check out the workshop if you're interested and able to come this Saturday.
Hey everybody, I just want to say thank you for listening to the Seeking Wellness podcast. I would love it if you subscribe so you never miss out on any of these great episodes. If you haven't left me a review yet, that would mean the world to me so I can implement any of your feedback that you have for me. And if you feel compelled to do so, share this out with more people, because my goal is to connect with and help as many people as possible in our community. And finally, if you have any ideas for future episodes or suggestions on guests I should interview, please shoot me a message because I'd love to hear from you. Thanks again, and until next time.